Lobotomy is a process whereby a probe is inserted through the eye to sever brain connections. It was a widely practiced form of psychosurgery, used to treat everything from insomnia to schizophrenia. Over the years, the treatment of mental illness has been quite gruesome, and there was no defined way of addressing it. Antonio Egas Moniz developed a brain operation known as the leucotomy. In this procedure, a sharp instrument was inserted into holes drilled in the patient's skull to access the brain. The aim was to sever the connections between the frontal lobe and the rest of the brain. This process was met with hostility and doubt from the medical community, and the technique was soon discarded. Despite the initial skepticism, some doctors embraced the method. Notably, neurologist Walter Freeman popularized it in the USA, believing it to be a revolutionary treatment. To make the procedure more accessible, Freeman began to experiment and worked with Italian psychiatrist Amaro Fiamberti, who performed lobotomies by accessing the frontal lobes through the eye socket, a method known as the ice pick lobotomy. In 1946, Freeman performed the first lobotomy on a live patient and subsequently began teaching the technique. He traveled widely, teaching his methods to medical staff and performing the procedure himself, charging $25 per session. From 1946 to about 1956, Freeman estimated that he had performed around 4,000 lobotomies. The process, however, was not always successful. It often led to the loss of lives and left many patients unable to perform basic tasks. Some patients, like Rosemary Kennedy, were left with severe mental and physical disabilities. Freeman's last patient, Helen Mortensen, died from a cerebral hemorrhage. Following this, Freeman was barred from performing surgeries in 1967, but the practice of lobotomy did not immediately cease. Over time, antipsychotic and antidepressant medications proved to be more effective than the surgery, leading to the decline of lobotomies. By 1970, lobotomies were banned in many countries. Antonio Egas Moniz, who had initially developed the procedure, was awarded the Nobel Prize, but there were subsequent calls to revoke the prize due to the procedure's controversial nature. Thank you for watching. Don't forget to like, share, and subscribe.